Welcome to the eighth and final session of the 4+2 diabetes reversal strategy. So today we're going to summarize and go through all the steps, and we're going to go through right from the mechanism through to the behaviors, and then land at next steps. What can you do beyond what you've learned so far? So let's dive in and look at this in its entirety. So diabetes, as we described, is this disease or disorder of energy overload. So energy we get from food, we store it as fat. So energy overload is too much fat. And it's a story about how the body tries and ultimately fails to accommodate. So our buffers get overwhelmed and we start to store fat in the wrong places. So each person's threshold for decompensation is different. And this really explains why we see people with diabetes who are very overweight, somewhat overweight, and sometimes we even see people who are diabetic who are not what we would describe as overweight. But nonetheless, this energy overload component exists because the threshold for it is different in each person. And so energy overload, too many calories over time from a personal perspective. And these energy buffers, we've got the buffer for our glucose system, which are our muscles, and the buffer for all of the energy system, which is the fat. It gets overwhelmed and we get fat in the wrong places. Fat in the muscle tissue and the muscle cells leads to insulin resistance in the muscles to make things worse. Fat in the liver drives much of the insulin resistance that we see in type 2 diabetes. And finally, fat in the pancreas is what causes the dysfunction of the pancreas beta cells and the inability to produce enough insulin and the resulting high blood sugars. So when we see too many calories and energy overload and the muscles not being able to take up the glucose from the nutrition that we've eaten, and the fat cells getting so full that they start to spill over fat, that fat comes back and it comes back to the liver. And when it's at the liver, what happens is it decreases the liver's ability to respond to insulin. And so remember, when we're not eating, our liver is producing a steady state of blood sugar under control of the pancreas via insulin. And so if the liver is not responding as well to insulin, we start to see that blood glucose go up a little bit, and the pancreas has to respond by increasing the amount of insulin. And so with insulin resistance, we start to see higher and higher levels of insulin. And the problem, of course, with insulin is that it's a storage hormone. And so as the levels of insulin go up, we begin to store food, store the energy from the food, but the high levels of insulin stop us from being able to access that and use that energy. And so we start to accumulate fat and we start to gain weight and become overweight. The liver also exports fat, and it exports fat as triglyceride, and that triglyceride circulates in the body, but a lot of that triglyceride ends up in the abdominal or visceral area, and some of that ends up in the pancreas. A small amount of fat in the pancreas can actually cause beta cell dysfunction, and we start to see insulin secretion drop, and we close the loop. And so here we have the twin cycle theory Dr. Roy Taylor came up with in the Newcastle group and researched this all the way from cellular cultures all the way to primary care reversal strategies, confirmed that this was the same mechanism that we see for type 2 diabetes reversal in bariatric surgery, and really points the way for what we're trying to do. Because if we can break this cycle, we can stop insulin resistance and we can reverse type 2 diabetes. So the way we break the cycle is we've got to get rid of the liver fat, and this will allow the insulin requirements to go down, insulin levels to go down, which will help us in turn accelerate the process. So if we can lower the insulin, if we can lower the fat, how to stop this cycle? We need to get rid of the liver fat, and that'll allow us to decrease our basal insulin requirements and normalize our fasting blood sugar. We also need to get rid of the pancreas fat, and that will improve the pancreatic function, improve the insulin response to meals, and allow us to normalize post-meal blood sugars. The amount of fat isn't a lot, right? So the studies by Taylor's group and others have shown it's about 400 grams of fat that's in the liver. That visualized as a pound of butter tucked under the right rib cage, yeah, that's kind of significant. But in the context of losing weight, a pound is not very difficult. And so what we see, though, is we don't just lose it from the liver. We have to lose it everywhere. And in the direct study, we saw 86% remission if there was greater than 15 kilograms, so 30 plus pounds of weight loss. Now, that will vary depending on the person. So it depends on kind of where your personal fat threshold is. But it's a significant weight loss. So the 4+2 diabetes reversal strategy is really designed to address this. It's designed on the basis of this twin cycle theory, and it's designed to address this function. So the first thing that we want to do is we need to eat to lower insulin. So if we decrease the amount of insulin required by decreasing our carbohydrates and increasing our fiber, we can start the process. And the importance of lowering the amount of insulin is, first, it'll help us get the blood sugars under control. But second, as the insulin levels lower, we'll have the opportunity to start to burn fat. And as long as insulin levels stay high, we can't burn the fat. And so we do this with a whole food, low carbohydrate, or really, I like to kind of say a whole food, slow carbohydrate diet. So we need to watch the carbohydrates. We do it by adding and being sure that we're getting enough fiber. And so the fiber is going to fuel it's going to fuel the good bacteria in our microbiome. Those good bacteria will make the short chain fatty acids that help with the hunger and satiation hormones. So we'll actually have less appetite and feel more satiated because of the fiber in our diet. It's also going to slow down the absorption of glucose so that we don't generate as much of an insulin response. And the other aspect with glucose coming from carbohydrates is we just don't have very much glucose circulating in our blood at one time. It's just simply a single teaspoon of glucose that circulates. And so if we eat foods that very quickly get absorbed and have multiple teaspoons of glucose, we're going to need to release a bunch of insulin. And insulin, as we said, is the storage hormone, right? So it's triggered by carbohydrate, but it's going to store everything, right? So it's going to store fat, it's going to store protein, it's going to store the glucose. And it's going to stop you from breaking down the stored forms of fat, glucose, and protein. Looking at this another way, we see glucose versus insulin over time. And what happens, so your normal fasting blood sugar here at 5.5 millimoles per liter, that's equivalent to that single teaspoon of glucose. And over time, with insulin resistance, we start to see insulin levels having to go up and up and up in order to maintain that blood sugar. Because our body does not want to have high blood sugars, because sugar, remember, it's sticky, right? It's sticky, it sticks to things, it's toxic. So high levels of sugar, not desired. We want to keep it to that single teaspoon. We will release more and more and more insulin to do that. And the challenge here is as that insulin level goes up, we start to lose our ability to use fat as fuel. So we can eat, we can store the energy, but with high levels of insulin, we can no longer access that energy. And really, this phase of insulin resistance is challenging because it doesn't show up on a blood sugar test. So if you went to your family doctor at this point in time, your blood sugar would be normal. Nothing to worry about. Blood sugar is normal. If we look at our lipid profile, our cholesterol profile, you probably would start to pick it up because the triglycerides are high, the liver fat, right? So the liver, it shows that the liver is exporting too much fat. And when triglycerides go high, HDL cholesterol goes low. And so we see that reduction of HDL cholesterol with the triglycerides going up. And so that's what you would pick up if you're checked by your family doctor, kind of on a routine check. The other thing you would notice, and this is probably something you can notice yourself, is just that your waist circumference is going out. And so Waist circumference is actually a great way to kind of see if you're starting to store fat in the wrong places. And so as your waist circumference goes, over 102 centimeters for men or over 88 centimeters for women, you're at higher risk. You're starting to store fat in the wrong place. And so that's something that I encourage people to kind of keep track of and measure. Eventually, these insulin levels, they plateau because the pancreas now is affected. And so the pancreas cycle kicks in, and the pancreas can't keep producing more insulin. And at this point in time, we call it prediabetes because the blood sugars start to deviate from normal. So we start to see blood sugars of, 6.0, 6.2, and we start to see those kind of just a little bit high fasting blood sugar. And this doesn't happen often until about 10 to 15 years into the process. So it takes a while to get here. By the time we have a prediabetes diagnosis, insulin levels are 2 to 3 times normal. And there's a 50% reduction in pancreatic beta cell function. So half of the pancreatic beta cells are working double time, the other half are not working properly. And so we've got real dysfunction at the pancreas. But now we're starting to flatten out in terms of our ability to produce more insulin. Left unchecked, the pancreas starts to produce less insulin. Still higher than baseline, still higher than normal, but not enough insulin to control blood sugars. We have the diagnosis of diabetes. And generally by this point in time, you've seen an 80% reduction in pancreatic beta cell function. This first phase is really insulin resistance, and it happens without blood sugars going abnormal. And the second phase is where you get this decreased insulin secretion, and the pancreas is affected. And that's where you see the blood sugars being elevated. And really, if we're going to reverse this, we have to understand it, and we have to look at the whole picture. And so as we start to reverse from diabetes, we kind of go from diabetes back to prediabetes and then work our way back down the insulin resistance chain. So decreasing insulin in and of itself can be useful because if you look just kind of here, if we eat in such a way that we don't need as much insulin and we don't produce as much insulin, one of the things that can happen is we can start to control our sugars just on the basis of what our pancreas is currently capable of doing. So, you look at the difference between choosing, a bowl of basmati rice, which is the equivalent of 10 teaspoons, versus a bowl of lentils, which is 1.9 teaspoons, right? And that bowl of lentils is probably going to be absorbed over a course of an hour. It's probably not even going to budge your insulin levels, whereas the basmati rice is definitely going to spike your insulin. So making those kinds of choices to eat in order to lower our insulin levels is the first step, and it's so important. The other thing here is choosing foods that have fiber, and choosing foods like lentils that have the fiber, that not only do you not get the insulin response, but you get the fiber response, which is going to help satiate you more. Clearly, we want to get rid of foods with just added sugar. We don't want to drink our calories. You can kind of see, even a glass of orange juice, good old healthy orange juice, the equivalent of 6 teaspoons of sugar. Cranberry juice, 12.5 teaspoons of sugar, way too much. And so what we want to do is avoid that. Fruit's not the issue, right? You look at berries, very, very low in sugar, very, very low in sugar equivalents. It takes time for that sugar to be absorbed. It doesn't budge on insulin. An apple and orange, even there, 1.8 versus 2.2 teaspoons of sugar. Again, kind of looking at that, kind of with the fiber in the fruit, probably not going to budge your insulin very much. Add it with a little bit of protein, and it really isn't going to, the absorption really isn't going to be very rapid, so you're not going to need to release a lot of insulin. So really what we want to do kind of in this first step is be thinking about how we can eat in order to lower our insulin requirements. Our second step, our second component to this strategy is we want to use our muscles. We've talked about the muscles being having this role as this glucose sink. And as in that role as glucose sink, they can lower insulin levels, right? So if the muscles are more efficient in terms of taking on glucose, we don't need as much insulin to push in the glucose. The amount of exercise is not huge, right? 150 minutes per week. Um, Moderate to vigorous exercise will get most of the job done. Now, we don't need to limit it there, but 150 minutes a week, that's what we start with. And this really takes advantage of the fact that normally the muscle is going to absorb 80 to 90% of the glucose that we eat. And it's going to store it as glycogen, and that's that buffer. And we like that. And so that's the glucose sink that we want to reestablish here. And we see within this twin cycle theory, the central component of that muscle insulin resistance. And so if we can overcome that by exercising, then we can take away one of the drivers of our insulin resistance process and start to reverse our type 2 diabetes. The third step is we need to be kind to the liver. We've seen in the twin cycle the central place that the liver plays in insulin resistance. The baseline insulin requirements, insulin levels go up and up and up. And that's really on the basis of what's happening at the liver. And so if we have fat in the liver, we're going to have insulin resistance. And if we have insulin resistance, it means that our base insulin will be high, which means that we will not be able to burn fat. So we get stuck here. And this is this metabolic vicious cycle. And so clearly we're going to do step 1 and step 2, which are going to help, but we cannot add to this. So we want to stop the sugar, especially it's the fructose, right? So the sugar, we want to be able to stop that. We want less alcohol, and we need to improve our gut health. And so when we look at kind of these components for liver fat, we now start to need to think about fructose, not the fructose in fruit, because the concentration of the fructose in fruit never hits the liver at such a stage that it adds to liver fat. It's the fructose in added sugars. It's alcohol. And then the third component here is gut health. As we've shown kind of in our liver session, anything that causes irregularities in terms of gut symptoms very likely is causing some leakage of bacterial toxins and bacterial components from the intestine into the portal vein, which goes to the liver, causing inflammation and fat in the liver. And that increased fat in the liver from these three things, really I refer to, it's fuel on the fire. We just don't need to put fuel on the fire, and we need to take it off if we're going to try to reverse our insulin resistance and our type 2 diabetes. The fourth component here is we've got to restore the fat burning. And so the good news is if we've done the first three things, we've set the stage. We're ready to burn fat. And in fact, most people, just the function of eating to lower insulin, just doing that, most people will find that their appetite decreases, their satiation increases, they eat less, they start to become, their insulin levels start to drop, they start to burn fat again, and they start to lose weight. Adding in the exercise helps, and then making sure that there's not other factors that are getting in the way in terms of the liver. So it sets the stage for restoring fat burning. But of course, we have to have a negative energy balance, so there needs to be less energy coming in than going out over time in order to lose weight. So one of the ways that we really like to do this is time-restricted eating. And the reason we like this is just if we can extend the fasted period, so starting at 12 hours, but even extending beyond that, we can eliminate kind of the empty calories of nighttime snacking. We will consume less calories doing this for sure. But during that fasting process, insulin levels go down, quite low naturally. And once we get the insulin levels low enough and we restore fat burning, what we find is our body starts to switch to fat burning, and our appetite almost disappears. And I know from our programs when people hit this stage, because they'll come in and often it's 2 to 3 weeks into this, and they'll say, I'm not hungry anymore. I always wake up hungry, and I'm no longer hungry when I wake up. And that's a sign that your body is starting to burn fat because you've got lots of fuel. So back to our fuel tanker, you're now no longer just accessing that small little fuel tank up front. You're accessing the big, store of fuel that is fat. If we want to use our magic wand, we do some aerobic exercise in the fasted state. Closest thing we have to a magic wand. So obviously not that close, but it's a really good habit. It's something where you can combine two things. The aerobic exercise is good in and of itself, and the aerobic exercise will burn fat. But in the fasted state, you're already burning fat, so you're primed to burn fat. And what is really interesting about this is it seems to be that we would preferentially burn the visceral fat and especially the liver fat through this exercise. So it's that's the game. We're trying to get rid of that liver fat. This may be kind of a secret step that we can take to do that. So getting up in the morning before you've eaten and getting out for a brisk walk or a run or a cycle or doing something aerobic can be a very useful part of this strategy. And again, that pound is what we want to try to get rid of out of the liver. And it's going to take probably a little bit more than a pound weight loss. So, the direct study, 86% remission if there was greater than 15 kilograms, so over 30 pounds of weight loss. And that's the four. The core part of our diabetes reversal strategy are these four elements. Eat to lower insulin, use your muscles, be kind to your liver, and restore fat burning. It's not always the whole story though. And this guy, cortisol, sometimes kicks in. The effect of cortisol can be real headwind in terms of the reversal of type 2 diabetes. And so cortisol's effect is it essentially elevated levels of cortisol increase insulin resistance. So we need to learn to find ways to de-stress or pull down our stress levels, to pull down our cortisol levels. So we can avoid stress, we can change our perception, we can improve our ability to recover. And so this has to become part of our strategy. And the final component to this is sleep, right? If we're not getting enough sleep, our cortisol goes up, our appetite goes up, and we derail everything that we're trying to do. So prioritizing sleep as well as investigating kind of any warning signs of obstructive sleep apnea are vital here. So that's the +2, really kind of the cortisol mediated behaviors. So we need to focus on de-stressing and improving sleep. Putting it all together, we have these six elements with the behaviors that fall off of them. And what we really focus on here in the 4+2 is working at that foundational behavior level, working at the level that the behaviors that you're doing become habits. They're not things about willpower. The habits become, you stack them on top of each other and you continue to improve over time. And so when we look at next steps for this 4+2 program or 4+2 process, really what we do in the clinic is we look at it from three kind of phases. So the induction phase is getting people where they're able to do the 4+2 lifestyle, really the 4+2 behaviors consistently, kind of across the board at the 101 behavior level for sure, and usually at the next step level. They're very comfortable with it. It's not hard. It's their new habits. It's their new normal. And then we see what their progression is, and we see how far they've progressed with their diabetes reversal. And then we do the intervention. So remember in the direct study, the intervention was a hypocaloric diet, right? So basically, really a restriction of calories coming in. And what we do is we don't put people on a meal replacement hypocaloric diet. What we do is we use the same foods that you're eating normally. And we simply extend the fasting window to 16 hours. And then be sure that the amount that you're eating in the 8-hour eating window is enough to achieve a significant weight loss. And we usually look at that for an 8-week intervention. Not everybody needs to do this, but some people definitely will need to do this in order to get a significant amount of weight loss to reach their target. From there, we go back to the indefinite phase, which is really the sustainable 4+2 lifestyle. So these behaviors have become habits. The habits you no longer have to think about. And really from here, the transition back from the intervention stage to the indefinite stage is quite easy. And this is really kind of, I think, what's different from our program than programs that are diet-based, where the intervention is completely different than what you need to do to maintain it. And so here, what we do is we work our way into it. We do the intervention as necessary. So if somebody actually, and we have many people that reverse their diabetes and insulin resistance without ever doing an intervention, but we use the intervention if we need to. And then we have the follow-up period where we go back to the sustainable behaviors and make sure that things are, we monitor and make sure that things are staying even and staying steady. And then we constantly kind of look, what behaviors are challenging for us, and we continue to work and coach around those behaviors until they become habits. And ultimately, the change that we need to see here is really, it's really habit based. So that's the program. And I thank you guys for going through this 8-week learning component of it, and lots of resources within this course. And we look forward to seeing you reverse your insulin resistance and reverse your type 2 diabetes.